Good evening and welcome to Plastic Surgery Issues and Answers. I'm your host as usual, Dr. David Watts, and if it's Wednesday night and it's 7:30, you know it's got to be plastic surgery. That's what we love to talk about. That's what we love to do, and we're so happy that you're joining us tonight live here on WMCN, where we can talk about and discuss anything that you want to talk about regarding plastic and cosmetic surgery. You know, we've been doing this for 18 years now. Can you believe that? 18 years. And I look a lot older than I did 18 years ago. You can believe that? You know, does anyone here know a good plastic surgeon that can help me out? That's what my problem is. I want to tell you all a funny story. I had a patient that actually came in this week, and she had a mini facelift. And literally, and I swear to you, she looks probably about 38 years old and she's 62. Absolutely outstanding. And I wish I could take total credit for it, but her bone structure is just outstanding. But every time she comes in for a post-operative visit, I'm just starting to get jealous because she looks so good. I'm like, I need to get hooked up a little bit with a little tuck here, a little tuck there, and really get me going, because these patients are coming in, and where we've had a tremendous amount of success and great results are with the mini facelift in combination with the upper eyelid surgery to take off the excess skin. And the bottom line is, I just keep thinking, wow, I got to go and find one of my buddies that I train with to see about giving me a little nip and tuck, because seeing these patients get these great results, it really makes you jealous and you want to get touched up yourself. So I just mentioned that, and that is an absolute true story. I had another patient that we did. It was a guy we did a mini facelift on, and he was 52, the same age as I am, and the guy looked like he was like 35 again, and it was like, oh my goodness. So I'm feeling the Jones and then the jealousy every time we get these patients that come back in with these great results that we get. I tell you, the thing of it is, it's really warming up. It was so nice to come here to the studio and just be able to wear like a little sweater or a little light jacket. It feels great. We're coming into the springtime, but one of the things that I can tell you, this is plastic surgery time. Believe it or not, we've been bundled up in the wintertime. It's cold. And you really don't think about, wow, I want to look good, because all you're thinking about is staying warm. I know when I go to the gym early in the morning, the thing I'm just thinking about is like, oh, let me just stay warm, and I'm wearing hooded sweatshirts and I'm trying to like stay warm. But pretty soon it's going to be breakout time. I mean, today we're into the 60s. Later on in the week we'll be into the 70s, and all of those unwanted pounds over here on the abdomen and the thighs that you are like wishing that you could wear those heavy winter clothes will now be exposed, and this is the time to get it done. And the great thing about plastic surgery is, and they have it up here of the things that we do. Under the cosmetic procedures, we do the full facelift, but one of the things that we're doing a tremendous amount of now are the mini facelifts. The recovery times are very, very fast. And anybody that wants to talk about the mini facelift, please feel free to call in. Brachioplasties, which are arm surgery for those bat wings that you've heard Oprah Winfrey talk about so often. We have two types, the full brachioplasty and also the mini, where it's a little tuck under the arm and the scars are hidden very well. Tummy tucks, we did one of those today. Breast augmentation, we did one of those today. Rhinoplasty, which is nose reshaping. Liposuction, we did some of that today. Otoplasty is the ear pinning for ears that stick out. That's what I need. Paniculectomy is the big tummy tuck. Blepharoplasty, eyelid surgery on both the upper eyelid for the excess skin and the lower eyelid when you have the puffiness and the bags and the creepy skin underneath the lower lid. And the ever popular, and again, we did one of these today, the Brazilian butt lift, and that's where you actually take fat from other parts of the body to give that J-Lo or that big Kardashian derriere, I guess is the best way to put it. We also do reconstructive procedures. Believe it or not, we do hand surgery. Facial fractures, okay, we do mandible, which is the jaw fracture. We do fractures around the eye. We do nasal fractures. We do burns. I actually had a little baby that came in last night that had a burn to her arm. She had spilled some hot tea on there. Breast reductions we do. Breast reconstruction for breast cancer. We do all types of skin lesions. We do moles, we do cysts, we do lipomas, we do skin cancers, okay, the basal cell cancer, squamous cell cancers, and then the bad player, melanoma. We talked about paniculectomy, which is the big tummy tuck, and basically where your tummy hangs over the pubic region. We do the carpal tunnel release for carpal tunnel syndrome. Trigger finger, this is when the finger pops and you can't extend it. And gynecomastia, that means enlarged breast in males, okay? Now, if you'd like to come in, this is our April and May schedule. Remember, all of our cosmetic consultations are absolutely free. So if you don't get on the air and get to ask your questions, come on in and you will get a consultation with me directly. I will not pawn you off on a junior partner or some nurse practitioner or some cosmetic coordinator. I sit down with you, I go over everything, and we make it very individualized, I promise. We are in the Vineland office every weekday evenings and also Saturday mornings. We are in Philadelphia again on April the 12th, again Saturday, May the 10th. We have Tammy on the line. Hang in there one more second, Tammy. We will be in Salem on Friday, April the 18th, and again on Friday, May the 30th, and we will be in Turnersville, T-ville, on April the 17th, and again on Thursday, May 1st. Well, the phone lines are lit up, and we are ready to go with our first caller. Our first caller is Tammy from the Big P, Philadelphia. Hi, Tammy. How are you, my friend?
Hello, doctor. How are you?
I am doing outstanding. What can I do for you tonight, my friend?
Well, like I explained to your receptionist, I had gastro bypass surgery.
Okay.
And I had plateaued at 250, but I gained like 30 pounds. So I'm trying to lose that.
Okay.
My question is, should I lose more weight besides the 30 pounds that I did gain to get plastic surgery? And is there a way that I can finance it, because insurance do not pay for the excess skin after gastro bypass?
All great questions, Tammy. You get an A+ for your questions. Let's talk about it for a minute. So the first question was, should you lose more weight? If you've lost 130 pounds and your gastric bypass or your bariatric surgeon feels that you're within your ideal body weight, in other words, you've lost all that you're going to lose and you're not fluctuating enough, what we call in the steady state, then I think it's time to come in and get things done. Now, the good news is some of this stuff is covered under insurance. So many times, and again, it depends on the insurance and it depends on your plan, but I can give you trends. The trend is that most breast reductions we can get approved, okay? And then the paniculectomy, or when your stomach or the excess skin hangs over, we can usually get that approved through insurance, especially if you've gotten documentation from your physician. So what am I talking about? And everyone at home who's listening that's had the gastric bypass, the gastric sleeve, or the lap band, and you're thinking about how am I going to deal with all this excess skin, you need to start way in advance on working this, not like you've lost your weight. And just like you prepped for your bariatric weight loss surgery, you need to prep for plastic surgery. Now, what do I mean by that? Whenever you're going to get a gastric bypass or the bariatric surgery, you have to go to classes, you get counseling, and you prepare for it. Well, once you've had your gastric or bariatric surgery and you've lost the weight and now you have all of this excess skin, you need to prep for that. So what kind of prep do you need for plastic surgery? You need to be able to document that you're having problems in order for the insurance company to pay for it. So you need to prove that you have rashes in the fold. You need to prove that you're having back pain. And the way you prove these things is actually to go in and see your doctor, have notes written, make sure that they give you creams so that you can show that the pharmacist has records about the medications that you've been given, the fact that you may have gotten boils in the creases or whatever the problem is, it's been documented. This way, when you come in to see me and we do the consultation, what happens is that we can send off now all of these issues that you're having as a packet to the insurance company, and we can see about getting it approved. Where it gets very difficult is if you don't have any documentation. You're like, well, I was having problems. I treated myself over the counter, with medications that I got from the drugstore. I never really went to see anybody. Then it gets hard because the insurance companies are like, well, clearly you weren't having a problem because there's no documentation. You were having a problem, but you just didn't have it documented. And the best thing to do is to go see your doctor. If you're having back pain, if the weight is pulling you down, go see a chiropractor, go see an orthopedic surgeon. Some way so we can have essentially documentation that you're having these problems. When you have documentation, very easy to get this approved. When there's no documentation, this is when things get difficult. This is when it gets hard for us. So that's a little bit of preparing to come in and see us once you stabilize with your weight. Now, the things that they will not cover under insurance. If you have excess skin and you've lost weight in your neck and the skin is hanging. If you have excess skin on the arms, that's usually not covered by insurance. Excess skin on the thighs and also on the buttocks region. If you have excess skin on the back, that's usually not covered either. We do, Tammy, to answer your question, have all kinds of financing plans, and maybe they can put that up on the screen for us. Liam can help us out with that, and then we can go over some of the different financing plans that we have, and here we go. Liam is spot on as usual. All right, we have what we call our 75% option. This is probably the favorite plan, and this is where you put 75% down, and then you pay the other 25% off over time. Now, the great thing is it's absolutely interest-free. We also have a loan option, Care Credit, and that works very much like a credit card. They go ahead and pay us, and then you pay them back over time at some interest rate. And then we have what we call the established payment option. I like to call it the layaway plan, and that's where you put your money down, and when you reach the total amount, you come on and you can get your surgery done. One of the things that we do at our practice, which has worked out so very, very well, is that we bundle the fees so that there are no tricks, there are no games, and as I like to say, there is no okey doke. And what that means is that the surgeon's fee, the anesthesia fee, and the facility fee are all combined, so the price that we give you is the price that you pay. If the surgery lasts longer, it's still the price that you pay. There are no games where you get anesthesia bills later because of the fact that we ran over in time, or we stayed longer, or we had to use more sutures, or we had to use more drapes, or we went through 2 more pairs of gloves, and now you're getting all of this itemized bill. None of that occurs with us. You get the one fee up front, you pay the fee, and it's over. And we actually have some of the most reasonable prices in town because we understand about the economy. We want plastic surgery to be affordable. So we really work hard to make sure that our prices are extremely reasonable. But the thing I will tell you is we do not compromise care for price. I think we get some of the best outcomes and best results in the whole area, and we really take pride in our work. And in my mind, ours is really artistry in what we do. As many of you all know, my father was an artist and still is, and I think I picked up some of his talent, although not quite as good as he is on the canvas. But my canvas is with patience and also being able to see what you're going to look like before we finish. And that's just been a gift that I got, I think, from him. But that's why it's really not just surgery. In my mind, we've really combined surgery with artistry and have put it together, and this is why I think we get such fantastic outcomes. But we're also sensitive to price. We realize we're just coming out of a recession. We know that times are still difficult, and so therefore we've really tried to make our prices very reasonable. And we have not raised our prices in 4 years, which again I think gives testament to the fact that we get it, we understand, and we realize what's going on out there in the world, and we're not living in some ivory tower or clueless to what's happening with the economy. If you'd like to call in and talk to us, we would love to hear from you tonight. Anything that you want to talk about, facelifts, liposuctions, tummy tucks, breast augmentation, breast lifts, and breast augmentations, whatever it is, the number is listed on the screen, area code 866-472-8868, and we will take your calls. We are live in the studio tonight. And again, I want to hear from my folks. I know you're out there. I know my family's there. And we want to hear from you tonight. We had a tough day in the OR today. We had some really, really big cases. I'll tell you about an interesting one that we had today. We had a patient that came in today for surgery who had undergone a breast augmentation 30 years ago. And she had basically breast implants because they were the old silicone, and they were polyurethane shells, which are the shells or the capsule that they used to make a long time ago. And basically what happened was the shells had just disintegrated. Now that is totally different from the new silicone implants, the new gummy bears, because they're what's called a cohesive gel, which means it can't disintegrate, it can't fall apart. There are no leaks. If they are, they self-seal. Totally different than the old kind. But these were in from 30 years ago, and it was this sticky, gooey mess trying to get it out. And then because the body reacted to that silicone gel, it formed almost like an eggshell capsule around the implants, and we had to get that out. And then we had to try to tighten up the skin where all of this sticky, gooey gel had been, and then where the eggshell capsule had been. And so they definitely tested my skills today, and we were in the game. But I am happy to report we did overcome. We got a great result for the patient. Everything was good. All the tissue was healthy and viable at the end, because that's always a question. So always a great result, good endpoint, but it tested my skills a little bit, and the blood pressure went up trying to keep everything alive, but a great result. All right, our next call on the line is Cindy from Northeast Philly. How are you, Miss Cindy, tonight?
Try again later.
Are you there, Cindy? Hello? Did we lose Cindy? Okay, that's okay. Cindy, if you want to, please feel free to call back. We would love to hear from you tonight. And Cindy wanted to talk about a tummy tuck that she had some issues with, so we would love to hear from her about that. And but as I was finishing up my story on the case today, that was a tough one. Then the other case that we did today too, we did a tummy tuck, and it was interesting. The lady's tissue was very, very tight, and so we really had to work hard to get her abdomen nice and closed and to get things together, because all of her tissue was very, very tight and did not stretch well. But we were able to get everything done on that, and that came out well. So all challenges today, but luckily we were laughing and said that the plastic surgery God smiled on us today, and we were able to get very, very good outcomes. But the entire team was tested today on some challenging cases. You know what? But the staff was teasing me. They said, this is what keeps you on your toes. So I was definitely on the toes. I felt like a ballerina on my toes today, but everything went great. All right, our next call on the line is Ms. Amy. Ms. Amy from North Philly. How are you, my friend?
I'm fine, thank you. How are you, doctor?
I am doing absolutely past outstanding, if that's possible. What can I do for you, Ms. Amy?
Yes, I have a Bell's palsy on my left side, on my face. So I was wondering if there is anything cosmetically that I could do to make it more symmetry.
Yes.
Like my smile.
Good question. And for those at home who are not sure what Bell's palsy is, it's basically a paralyzation or the side of the face is paralyzed. And the best way to think of it is that if you think of someone who has had a stroke and the face droops, and what's going on, to break it down from a physiologic perspective, you have a nerve that supplies the face here. It's called the seventh cranial nerve, or the facial nerve, and it controls all the muscles of the face. So when you squinch up your eyes or you open your eyes, when you make your mouth pucker, that's all controlled by the seventh cranial nerve. And if you've had damage to that nerve, and the most common cause for Bell's palsy, no one really knows. Some people think it's a virus, but the nerve has basically been knocked out. And when it gets knocked out like that, you get this facial droop. Amy, to answer your question directly, now that we've described what we're dealing with, a thing that's a very easy fix on this is actually just a mini facelift. And what that will do is it actually will resuspend the tissues. It will help with your smile, because right now that skin and tissues are hanging down. We can tighten the muscles a little bit underneath. The recovery time on that is about a week, very, very fast. And the other thing that happens, believe it or not, with the seventh cranial nerve is that it actually closes the eyelid. And so if the seventh cranial nerve or the Bell's palsy occurs, you have difficulty closing the eyelids. So the patient tries to close the lid, but they can't. One of the things that we can do is stick a little weight in here, which helps you to close the eyelid, especially at night. What a lot of people have to do that have Bell's palsy, especially at nighttime, is they have to tape their eyelids shut with some lubricant so that the cornea won't dry out. So definitely come on in, Amy. We can definitely help you out, and we've gotten some really good results. Cindy has regained and gotten back in the game with us tonight. Hi, Cindy. How are you?
Hi there.
Hi. Can you tell me what's going on? We lost you last time, but you know what I want you to do, Cindy? Is I need you to cut down the volume on your television so I can hear you, because I'm getting a reverberation. And just talk to me over the phone. Go ahead, my friend.
Okay. So a year ago, I had a tummy tuck in Venezuela.
Okay.
But it was done, the surgery went well, and I healed very well.
Great.
But they made these points on the sides, on my two sides, and I have the right side, it's a little bit crooked. So I wanted to find out if I'm able to fix something like that.
Yes. So just to recap for everyone, it sounds like you have a couple of little bulges on the side. Is that correct?
Correct.
Okay. There's a name for that, Cindy. It's called a dog ear. And if you think of a Labrador retriever, you know how their ears kind of lop over like that? That's the name that they give it in plastic surgery. It's called a dog ear. And the reason that you got the dog ear is because, and go to the wide shot again, Liam, for me, so I can show them myself. When you make the incision, if the plastic surgeon stops the incision to try to not make it so long, and you still have a crease, in other words, on the side, and you have some excess skin, you need to make that incision all the way to where you get what we call a flush lie, which means that the skin is flat. If you have any overhang here and you don't bring the incision all the way over, you're going to get that excess skin, and that's called the dog ear because it kind of hangs over like a Labrador's ear. So that is a very easy fix. All we have to do is extend the incision a little bit longer to where it has a flat lie or there's no more overhang. We just trim off that excess skin, put in some dissolvable sutures, and it will literally take about 15 minutes to do it. If it's a small area, we can do it under straight local where we just numb things up. If it's a bigger area, then we may need to do a little bit of sedation. If it's really kind of bulging out around the side, then sometimes we need to do a little liposuction to bring things in and just trim away a little of the excess skin. But the bottom line is that it's a very, very easy fix, not hard at all. All right, our next caller on the line is Candace. Ms. Candace from Mount Laurel. How are you, my good friend?
I'm good tonight.
Good, good. What can I do for you, Candace?
I wanted to call because I wanted to know, is it possible, could you take fat, actually, from the fat from your stomach and, like, actually insert it into your butt. Is that possible? Like if you wanted your butt?
Yep, I actually did it today. That's the Brazilian butt lift, my friend. And we actually had a lady today that we did that. And the thing of it is, believe it or not, the hardest part on the butt lifts are to get enough fat. So I always tell really thin patients that come in that want to get the butt lifts, make sure you eat some Twinkies and get some fat, so I'll have some to take. And the lady that we did today, we liposuctioned her love handles, we liposuctioned her thighs, we liposuctioned the upper part of her buttocks, all in an effort to get fat, because then the fat has to get processed. We wash the fat, we clean the fat, and then when we inject the fat, you'd be amazed. So whatever we take off, only about half of that fat can be used. And you can take a look here. Great picture. This is the before picture. You can see this lady wanted a larger buttocks, and you can see she didn't really have too much, and you can see afterwards how we were really able to plump things up. We did liposuction on her tummy. We took it from the flanks. We took it from her thighs. Here's another one. She had some fat across the superior buttocks, the upper portion, but she was kind of flat below. You can see afterwards how we liposuctioned across the top and then filled it out along the bottom to give her a nice shape. So that is definitely the Brazilian butt lift, and we really look for fat anywhere that we can find it. So we would definitely liposuction your abdomen, we would liposuction your flank, we would liposuction your thighs, wherever we can get fat from, because the more fat we get, the larger we can make your buttocks. And the beauty behind the Brazilian butt lift is that it's basically a two for sale. You get liposuction, then followed by the fat injection, so you really get two procedures in one. However, we do not charge you for the liposuction, only for the fat injection, so it's really a great, reasonable procedure. The thing that is difficult on this is that you cannot sit for 6 weeks. Now your question may be that I've lost my mind and how can you not sit? But the key thing is that you lean forward when you sit and stay off of your buttocks. Listen, if you'd like to come in, we have operators standing by at area code 856-691-0200, and they'd be happy to take your call. They'll make an appointment for you at any one of our 4 locations, either in Vineland, Turnersville, Salem, or actually in Philadelphia. We only have about 15 seconds left for everyone who called in tonight. Thank you so much. We will be here again next week on Plastic Surgery Issues and Answers. Have a great one.